It's 2 p.m. Central African time on day 40 of the lockdown in South Africa. Coming to you live from our Auckland Park studios. My name is Nzinga Kunta. Thanks so much for being with us in the last hour of On Point for today. Let's take a look at the top stories making headlines at this hour. President Cyril Ramaphosa says while South Africa's scientific approach to the COVID-19 pandemic has stood it in good stead, the country is by no means out of the woods yet. The case of a 40-year-old Alexandra man allegedly killed by SANDF members enforcing lockdown regulations is being heard in the Pretoria High Court. Social grant payments continue today after SASSA says it fixed glitches in its system that prevented many people from accessing their money yesterday. The Africa CDC, the World Economic Forum and the World Health Organization are hosting a joint briefing on COVID-19 on the African continent. We cross live to that.
Global emergency as soon as possible. Through the platform, the World Economic Forum was able to rapidly convene a group of stakeholders to form the Partnership for Evidence-Based Response to COVID-19, known as PERC, a public-private partnership dedicated to supporting evidence-based measures to reduce the impact of the pandemic in African countries. PERC is led by the work of the Africa Centers for Disease Control and Prevention, the World Health Organization, Resolve to Save Lives, an initiative of Vital Strategies, the UK Public Health Rapid Support Team, and the World Economic Forum. And Ipsos and Novetta Mission Analytics bring market research and expertise and years of data and analytics support to the partnership. Today, PERC is pleased to share the findings of its first report, Responding to COVID-19 in African Countries, using data to find a balance, which will be released immediately following this call. Using data to find a balance provides first of its kind data and guidance to governments as they move toward a long-term response to COVID-19, including using real-time data to make informed decisions, how to adapt local measures as the pandemic and public perceptions evolve, and how to mitigate adverse effects by protecting the most vulnerable populations. To share more insights on the report, I'm privileged to announce our panel of experts representing the PERC partnership today, including Dr. John Nikasong, Director of the Africa CDC, Dr. Matashito Moeti, Regional Director of Africa, World Health Organization, Dr. Tom Frieden, President and CEO of Resolve to Save Lives, an initiative of Vital Strategies, and Dr. Daryl Bricker, Chief Executive Officer of Ipsos Public Affairs. Following our panelists' remarks, we will be using the Q&A function at the bottom of your screen for questions. We will make every effort to answer as many questions as we can before today's briefing ends. And with that, I'm privileged to welcome our first panelist. Dr. Nikasong, over to you.
Thank you, and thank you for the opportunity to be part of this panel and to have contributed in this important process. As the COVID-19 pandemic began to spread globally, African countries responded quickly and implementing public health and social measures, including curfews and lockdowns. Africa CDC developed the Africa Joint Continental Strategy for COVID-19 and got it reviewed and endorsed by ministers of health of the 55 member states of the African Union. And the Bureau of the Head of States and Governments have subsequently endorsed it. We train experts across the continent in surveillance, risk communication, infection prevention and control, laboratory diagnostics, and case management. This helped increase the capacity of countries to test for the virus and increase that capacity from about 2 countries in February to more than 48 countries in a few weeks. We also procured test kits and supplied to the countries in addition to the kits supplied by the World Health Organization and the US Centers for Disease Control and Prevention. We acknowledge the efforts of several partners we have worked with since the beginning of this pandemic to get Africa to where it is today. I thank particularly the African Union member states for their rapid response which has slowed the spread of COVID-19 across the African continent. I'd like to thank the Bureau of the African Union Head of States and Government for their continued support at this critical time. As we prepare for a long-term response, there is still much to be learned about the virus and the impact it will have on people and systems on the continent. As we continue with our response efforts, we must apply lessons from the past. We must also use evidence to drive decision-making so we can implement the most effective and responsible policies while protecting the lives and livelihoods of people. Finding the balance, the report of a survey conducted in 28 countries in 28 cities in 20 African countries offers a first-of-its-kind data to guide decision makers and governments in making informed decisions, adapting local measures as the pandemic and public perceptions evolve, and in mitigating the adverse effects of COVID-19 by focusing on protecting the most vulnerable populations. Key findings of this survey include 1/3 or 32% of respondents said they did not have enough information about the coronavirus, including how it spread and how to protect themselves. Across the 20 countries, less than half of the respondents, or 44%, said they were at high personal risk for COVID-19. Nearly 70% of the respondents said food and water would be a problem if they were required to remain at home for 14 days, and over half would run out of money. The population has some knowledge of COVID-19 and understands the need for public health and social measures, but the ability to implement them without significant hardship is limited. Governments must support the vulnerable. Policymakers can make use of the data in this report to make informed decisions, and Africa CDC will provide guidance and support for them to do this. With that in mind, the report makes 3 key recommendations to governments across the continent. 1, while caseloads remain low, they should build public health capacity to test, trace, isolate, and treat cases, which my colleague, Dr. Frieden, will speak on shortly. Secondly, to monitor data on how public health and social measures address local COVID-19 conditions and meet the needs. This will help determine when and how to lift or relax measures in a way that balances between lives and livelihoods. Thirdly, engage communities to adapt public health and social measures to the local context and effectively communicate about risks to sustain public support, achieve widespread adherence, and shared vulnerable populations. Also, we have seen security undermine our ability to respond to outbreaks. We must respond with a human rights approach. As the pandemic evolves, so will this platform by bringing together key data sources to support countries and allow us all to adapt and learn. And lastly, COVID-19 is not just a health crisis, it is a political and social crisis as well. All sectors must work together. The community, the government, the private sector, and the non-profit, political leaders, and the health sector to drive our decision-making and the next phase of the response. We must, however, pay attention to the human rights of the population as we consolidate and coordinate our efforts to respond to this pandemic. Thank you.
Thank you very much, Dr. Nikasong, for your insights. And I will now welcome Dr. Moeti to the floor. And on behalf of the partnership, we thank you very much for your time today to discuss the report.
Okay, thank you very much. First, I'd like to really thank the World Economic Forum for our partnership on disseminating information on the COVID-19 pandemic, and just say how very pleased I am to join in launching this report with old friends and colleagues, John Kangasong and Tom Frieden, and also with our colleagues from the WEF and from Ipsos. So it was a very great pleasure for us, my team and I, to join in this effort to highlight the importance of using data-driven approaches to inform public health social measures in response to the COVID-19 pandemic. We know that to stop the spread of this virus, the key public health measures should be in place in every community and at every stage of the response. We know also that to stop the spread of the virus, the key public health measures should be in place everywhere in countries. And these public health measures, I'll just repeat what John said, are surveillance, identifying cases early, testing the cases, tracing their contacts, and then isolating both the cases and the contacts. And even in communities that have not reported cases, readiness capacities should be pre-positioned. This is what I'm going to be focusing on. We must have the action move from the capital cities, where it was initiated in African countries since the virus entered the region mainly, or the continent mainly, through flights from other continents. But it must absolutely extend beyond the capital cities, beyond the formal health sector, and reach people at community level. In the past few months, countries have significantly strengthened their capacities, starting, as I said, in capital cities. All countries have set up incident management systems and built up laboratory capacities, as my colleague John Kengosong said, with support from WHO and the Africa CDC. We are training health workers in infection prevention and control and in case management. Supplies have been shipped and replenished, and mobilization of people at the community level and civil society organizations is underway. We're now working with countries and partners to quickly expand and decentralize these capacities and to ensure action is anchored in and engages communities and the structures through which they are organized. And we will use the findings in this report to strengthen our policy and technical advice and guidance to governments. In decentralizing the response, countries first need to build on their existing capacities. For instance, in Côte d'Ivoire, we've helped the government to build on ongoing efforts to strengthen primary healthcare and improve the functioning of the healthcare system to quickly expand capacities. This approach contributed to the government being able to lock down and limit the transmission largely to the capital city after it had started extending to some districts. They've been able to stop transmission in those districts. Countries are also leveraging assets strengthened in response to the Ebola outbreak and to other outbreaks, including community-based surveillance, integrated disease surveillance and response, in which we've been working with countries for many years in WHO, and real-time GIS systems and technologies to strengthen COVID-19 surveillance. Coordination at the local level, so moving beyond the capital to the provincial and district levels, also needs to be strengthened. And to support this, we've held webinars with over 500 district health officials around the continent and their teams on how to establish their local platforms to be able to manage and respond to this pandemic. We're advising countries to put in place strong regional teams, which can empower the most local level to organize the full range of response measures within health systems and communities, and to engage more people. Countries can, for example, repurpose government workers, call back retired healthcare workers. They've done that in a number of countries, fast-track final year health professional students, and most importantly, mobilize communities and engage partners. To give a couple of examples, South Africa and Mauritania have mobilized thousands of community health workers to support surveillance, contact tracing, and most importantly, to help people know and understand about this pandemic. In Malawi, additional health workers have been recruited and being given hazard pay, or the hazard pay they receive has been increased. At WHO, we have repurposed in our country offices our staff and positioned them in teams in provinces to support the government as they very quickly set up their capacities at those peripheral levels. And I'm sure that we could mobilize many of the people who have been trained in epidemiology and surveillance around the countries to be engaged at those levels. To better engage and inform communities, we're advising governments to work through their associations, through traditional leaders, through faith-based leaders and civil society groups. Finally, and most challenging, supply chains of essential commodities need to be strengthened within countries. At the same time, we're working with countries and partners to address worldwide shortages of test kits, for example, through the UN COVID-19 Supply Chain Task Force, through which we would like to collaborate with the African Union and the Africa CDC. Countries are taking proactive measures, including repurposing HIV and TB laboratory assets. For example, in South Africa, 39 mobile laboratories have been deployed. But we know that there are challenges with access to PCR machines, which are not available in all countries at the subnational level. So we are procuring additional equipment and looking how to use rapid diagnostic tests in resource-limited settings, working with regulatory authorities and referral laboratories. This aspect and the response needs to be monitored to anticipate and overcome challenging, and particularly in repurposing capacities, countries need to ensure the continuity of access to essential services to avoid seeing unforeseen increases in other diseases. In closing, the Finding the Balance report is an excellent contribution to supporting our collective evidence-informed action to save lives and to protect livelihoods in communities in Africa. Thank you very much, and I really value this partnership. Thank you.
Thank you very much, Dr. Muddy, for your remarks. And inviting next to the floor is Dr. Frieden from Resolve to Save Lives and Vital Strategies.
Good morning. Good afternoon and good evening. Thanks to Drs. Nkenkesong and Moeti for your remarks and for your leadership in fighting the novel coronavirus. I also thank the Africa Centers for Disease Control, the UK Public Health Rapid Support Team, and the World Economic Forum for their contributions and work on this report. It's been a partnership and a productive one. Thank you for that. I'm Dr. Tom Frieden, President and Chief Executive Officer of Resolve to Save Lives, an initiative of Vital Strategies. Resolve partners with countries around the world to help governments and civil society implement scalable, proven strategies to prevent millions of deaths from cardiovascular disease and epidemics. Our focus is accelerating action through speed, simplicity, and scale in low and middle income countries. I'd like to start by commending governments in Africa for swift action in response to COVID-19. Preventive measures were implemented throughout the continent before the first death was reported. This rapid response undoubtedly saved lives. At Resolve, we work with many partners throughout Africa to strengthen public health systems so they can better find, stop, and prevent new threats. I've really been encouraged to see these systems activated in many countries and many best practices on contact tracing, data management, public communication, and much more implemented and also shared with others. There are three factors that will be particularly important to weigh in this concept of finding the balance in Africa. The first is the age structure of the population. With fewer elders, there is less risk of widespread illness and death among the elderly population, but still there is the risk of the vulnerable populations and a lack of information about who is most at risk. Second, there are limited safety nets, and the ability, as the report shows, for communities and individuals to survive and thrive and flourish during a lockdown is even less than in many other parts of the world. And third, there is a critical scarcity of healthcare workers even before COVID-19. And therefore, it's crucially important that every step is taken to protect those who protect the rest of us and ensure that healthcare workers and other essential workers are protected. There have been many inspiring examples from Africa of work done that is built on the strong public health systems that many countries have and are developing in Africa. Liberia, learning from the Ebola epidemic, has scaled up contact tracing and other community-level work. South Africa has tested widely and, using the lessons from HIV and TB, deployed more than 28,000 healthcare workers in their response. Ethiopia, building on their strong community health extension worker network, has visited hundreds of thousands of homes to provide information. The explosive growth of COVID-19 cases seen in other parts of the world has not yet materialized in Africa. We don't know why. We don't know if this is something that will change in the coming weeks or months, but it should not provide false hope. It remains critical to prepare for the worst, even as we hope for the best. To prepare now and prepare also for a lasting recovery, we have to do three things. First, while caseloads remain low, build public health capacity to test, isolate, trace, and treat cases. The box-it-in strategy that is an essential component of actions to reopen society as soon and safely as possible. Second, we must protect our healthcare workers. They're the front line of the response, and we must protect their lives while they work to save ours. Third, we must continue essential services for non-COVID conditions, including maternal care, HIV, TB, malaria, vaccination, chronic disease, and more. We recall that during the Ebola epidemic in West Africa, more people died because of Ebola than from it, because of the interruption of treatments for malaria, HIV, TB, maternal and child health causes. Testing is crucially important. Public health must be able to identify those who are infected, including people who do not have any signs or symptoms. That means adequate supplies, laboratory technicians, reporting systems, so that patients learn of their results promptly. Isolation is also crucially important. And while this may happen at home, in many households, this cannot be done safely. And countries and communities should consider making separate housing available for the infected to curtail the spread. Third, contact tracing, crucially important. And it's been really encouraging to see the very effective work done in Africa on contact tracing. It's something that we're just scaling up now in parts of the US. And quarantine of those who are contacts. The virus spreads through a web, and the key is to stop that web at any step possible. We need to disrupt as many connections in the web as possible. And we also need to ensure that we're treating cases effectively, caring for patients in a safe environment, and protecting healthcare workers who deserve every protection. When health systems complete these steps, we can better contain the spread of COVID-19 and relieve pressure on the healthcare system itself. The bottom line, we have a long journey ahead. We are just at the beginning of this pandemic. It will be a difficult time, and there will be difficult decisions for decision makers to make, also for healthcare workers and communities and individuals. The best way to make a good decision is to make an informed decision. This means that data from this report and others, this means better information about everything from attitudes to mobility to symptoms to tests to deaths. This needs to be strengthened. We need to take this opportunity and crisis to know that every community should know the essential features that are happening there in order to guide their response. By understanding what's happening with the virus, what's happening in each community, together, governments, healthcare system, and people together can combat this terrible pandemic. So thank you to our partners. We're delighted to be part of this important work.
Thank you very much. And I would like to introduce our final speaker, Dr. Darrell Bricker from Ipsos Public Affairs.
Thank you very much. Ipsos is a global market understanding company located in Paris. I'm speaking to you today from my home office in Toronto, Ontario. So we truly are a global company where I'm under self-isolation, obviously. We do most of our work for governments and NGOs around the world. And through this activity, we become a partner with the World Economic Forum, and we're very pleased to be invited into this. Obviously, if you're in the public opinion research business as we are, you're interested in the evolution of public issues, and there's no bigger issue in the world today than this one. And it's one of those rare circumstances when you get to participate in a program that can actually save lives. So we were absolutely thrilled to be involved in this activity with our partners. We also have the benefit of having the facilities and the teams in the region to be able to undertake something as big as this project was, and it was a substantial research project at the scale and speed to actually get data into the hands of people who are going to be able to use it, as I said before, to save lives. The survey, just to quickly describe it, was in 20 African countries, focused in 28 cities. We did it by telephone in 16 of the countries. So by telephone, I mean by a combination of of mobile and landlines, so we had good coverage of the population, and it should be considered representative of the urban populations where we did the survey. 4 countries we did it face-to-face because health measures were not in place at the time, and we were able to do it face-to-face, and those 4 countries are Ethiopia, Ivory Coast, Cameroon, and Mozambique. The survey, as I said before, is representative of the urban population, adult population, 18 plus years and older. Total survey sample was 20,990 people, and we completed most of those interviews between March 29th and April 4th, so we did it very fast, but there were a few countries where it took a little bit longer, and we were wrapped up all data collection by April the 17th. So all the data you have, it's available there in the report. You can see it by country, and if anybody has any questions about how we did the survey, I'd be happy to answer them. Thank you.
Great, thank you very much, Daryl, and thank you to all esteemed panelists today. We'll now move into the Q&A portion of today's gathering. As a reminder, please utilize the question and answer box at the bottom of your screen, and we will do our best to answer as many questions as we can during the time that we have left. Our first question comes from Yahoo News, and the question is, can you speak about the specific dangers of COVID-19 in conflict zones, like Burkina Faso, Libya, and Somalia, and the complexity of responding to vulnerable populations affected by this violence? Dr. Moetti. And
so we come out of that briefing where the findings from a survey by Ipsos of almost 21,000 people from 28 cities in 20 African countries on potential COVID-19 measures, with a range of experts presenting some of their findings. One of the most important ones, of course, we know that we've got the information on your screen a little bit earlier on. Almost 70% of people who were surveyed said both food and water would be a problem if they had to stay at home for 14 days in order to self-isolate and try and break or flatten that COVID-19 curve, rather. That briefing does continue on SABC News, but here is where we leave our SABC3 viewers. Thanks so much for being with us. Good afternoon.
Refugee camps, places where displaced people are living, they are some of the most challenging, in which the dwellings that people living are extremely small. So the control measures, the prevention measures will be particularly difficult to put in place. I think what we can say, though, is that in many of these contexts, we have the presence of humanitarian actors. I think you're probably aware that the UN Secretary General just launched a global humanitarian response plan to this pandemic, where the resources are being mobilized for those actors, which are very often civil society organizations, to get some of the resources and work at the community level to address some of the issues that are needed to help people to prevent the spread of the virus. So it is extremely challenging. We have some partners on the ground and some experience in how to work in these contexts in the UN, working with civil society, and we are very much aware that it's important for these contexts to be addressed as well.
Thank you very much. And our second question goes to Dr. Tom from Vital Strategies. The question is, how would you go about catalyzing political will to address gaps? Additionally, how will you help low and middle income countries like Zimbabwe, who are unable to access lending with the World Bank, to achieve greater health security and overcome the massive hunger experienced by COVID-19?
So I think generating political will is something that requires an activated community, leaders in the community, and pressure on the government. Each different society will have different ways that pressure can be effective. One of the ways that we've worked in Resolve to Save Lives is to take the general role that we want to strengthen the public sector, we want to strengthen civil society, and we want to help them establish a monitoring framework that keeps everybody on track so that there is accountability. This is important for advocacy, and individual leaders and groups are important for advocacy. Many years ago, when I had my first public health job, a very wise person said to me, "You will only succeed if you get people outside of the government pushing you to do the things that you want to do." And it's a very important rule in just about every society. On the question of low-income countries and addressing everything from food security to the response, much has been done, but much more will be needed. The World Bank, the IMF, bilateral donors, countries themselves need to come to terms that we are in the most serious economic downturn since the Great Depression. We are in the worst pandemic since the 1918 flu pandemic. This is going to require global solidarity. Weak links anywhere threaten all of us everywhere. And we have to figure out how to generate the resources and also ensure that they're well and quickly used and get to those who need them most. We're going to see major changes with this pandemic and after the pandemic and how the world responds to emergencies. And the more effectively we do it now, the more we work together with global solidarity, the more effective we'll be. After all, we have only one enemy, a dangerous microbe. It's humans against the virus. And by working together, we can have the most possible success.
Great, thank you, Tom. The next question comes from the Leadership newspaper in Nigeria. And the question is, a number of countries are relaxing lockdown, including Nigeria. For Nigeria in particular, what would you advise? I can maybe ask the Africa CDC, Dr. John, to take the question.
Thank you. Thank you again for the opportunity. First of all, I'd like to really recognize the important work that the government of Nigeria, through the Nigeria Centers for Disease Control and Prevention, has conducted over the last couple of months to mitigate and prevent and control the spread of the virus. We all understand the impact of lockdown. And again, it speaks to the balance that this whole project was referring to, which is how do we balance between the impact on the people's livelihoods and saving lives there. So Nigeria is planning to unlock its cities. And my advice to Nigeria is simple. I mean, some of those measures that Dr. Frieden and Dr. Moeti mentioned, that they should continue to expand and strengthen their public health systems, especially the testing capacity, and not just in the major cities of Lagos and Abuja, but all through the entire country there. That way they will be able to pick up cases as they emerge, isolate them, and trace their contacts. That's the only way you can be sure to continue to function while maintaining a good handle, a public health handle on the situation in the country.
Great, thank you for your response. The next question for Tom. Are there any community responses that have developed outside government or business that are worth highlighting that you saw in the report?
Many communities have taken an active role here. Some of the things that have been done include providing education and information. Others include providing services or food for communities that are struggling, for individuals who are isolated, or for contacts who are quarantined. Communities have also supported their healthcare workers, recognizing that they are heroes on the front lines. Communities are essential to effective response. And if we look back on other epidemics, including Ebola, some of the things that really made a difference included rapid data-driven action by the government, engaging communities, working with, not against, community traditions, and understanding that an engaged community is a very powerful weapon in the fight against disease.
Great, thank you, Tom. And next question from Andrew Meldrum. How can African countries responsibly reopen to economic activity while also combating the spread of COVID-19? I'll maybe ask the WHO, Dr. Moeti.
Yes, I think it's said very well in the report, giving South Africa as an example, where they analyzed, if you like, and mapped different types of economic activity, identified those that are absolutely essential, including for the response to the pandemic, and then have a graduated approach to releasing progressively based on data as to, if you like, the testing, the contact tracing that is going on, the trend in cases, and progressively letting go and releasing economic activities to go on. Because I think it's already been said, it is the economic impact of the pandemic is going to be great anyway, and the measures are merely sharpening and making that worse on the most vulnerable populations. So there needs to be a combination of gradually releasing, analyzing the most critical economic activities that are to continue, including in some countries, agriculture. We've been very concerned about the lockdowns and their impact on agriculture for the future, not only for now in African countries, knowing that so many, such high proportions of the population are dependent on agriculture. So I think it is this database, evidence-based analysis and release and progressively making the changes that's going to try and keep the balance. And the balance is extremely important, as has already been said.
Thank you very much, Dr. Moeti. The next question comes from ABC News. And the question is, amidst our focus on COVID-19, how does this pandemic rank against threats from other disease and poverty in Africa? And I'll ask that to the Africa CDC.
I think that's a very important question. As Dr. Frieden mentioned, we should be very, very deliberate in our approach in fighting COVID. And as he rightly mentioned, during the Ebola crisis in West Africa, so many people died because of other diseases, not necessarily because of Ebola. As you look at the continent, you say, what are the things that we are routinely challenged with? I mean, they include HIV, tuberculosis, malaria, non-communicable diseases, and maternal child health programs. So we really need to be careful and thoughtful in our approach in responding to COVID, at the same time making sure that these other programs are not handicapped or are not destroyed inadvertently. So I think that one of our strategies that the Africa CDC is promoting is at the level of the head of states and government is to say that, yes, we should pay attention to COVID-19 aggressively, but make sure we protect those programs that are endemic all the time. So if you combine the death toll that results from malaria, TB, and HIV each year, they exceed 1 million across the continent. So that's very, very important that we have to, at the same time, keep an eye on that and make sure that these programs are protected.
Great, thank you very much.
I add on this, just to say that WHO has developed guidelines on how to do this, because we need to protect and ensure the delivery of services, but not then make that constitute a risk for transmission of the COVID-19 pandemic. And this is a very big challenge that we're helping countries think through now, how to provide immunization services for children while respecting physical distancing, for example, how to make sure that people are patient enough to wait and make sure that people can move. Because in some countries, the lockdowns are quite strict. You need almost a permit to be able to get from one place to another. So we're working with countries to really bring this down to the implementation level and make it very practical, taking into consideration the importance of continuing these services. Thank you.
Great. Thank you very much. The next question comes from Ryan Heath at Politico. And Ryan writes, we are already seeing American food supply chains fall apart. How confident can we be of Africa's food security? And what does the world need to do now to reduce the risks? I'll leave that to Dr. Moeti, perhaps to start, and then perhaps Africa CDC to comment.
Yes, thank you. I mean, already food security is a very big challenge in the African region. And we've recognized, it's already been said at the household level, that there are people who are food insecure already before this happened, and this is only exacerbated by their inability to earn their daily bread, literally, if they cannot move and run their little stall at the market or even buy their food. And more importantly, then in the longer term, by the inability to bring in some of the supplies that are needed for agriculture in a time that will enable the planting, etc., to happen in such time that when the the harvest happens when it is needed. We are working at the regional level with the other UN agencies, with the Food and Agriculture Organization, with the World Food Programme, and they are paying attention to this, very much supporting those multi-sectoral platforms that have been put in place in countries. The WFP is working now to set up a transportation system, and here I'd like very much to thank the African Union and the Bureau for having sensitized the heads of state on the need to open up humanitarian corridors to enable goods and people to be flown into countries despite these social and physical distancing measures. This is vitally important on the continent.
Maybe just to supplement that and say that, food security, even for Africa, even in ordinary times, has been a challenge. And there's no doubt that the situation is going to get a little bit more challenge with the COVID-19 pandemic. So I totally agree with Dr. Moeti's submission that a unique and particular attention needs to be devoted to the issues of food security. And at the level of the African Union Commission, they are taking that very, very seriously. There's a whole committee that is governed by the Commission of Rural Affairs that is looking into that aspect by bringing ministers together and senior leadership across governments to examine the position and policies that need to be in place.
Great, thank you very much. The next question is coming in from Compatriot Magazine. And is there any framework put together by the CDC that will guide the African countries or regions on how to approach controlling the COVID-19 rather than countries working in silos on their approach?
Yeah, excuse me, absolutely. I think very early on when the COVID-19 was spreading, the African Union Commission and the Africa CDC, together with the WHO, we hosted a meeting here in Addis Ababa. That was February 22nd, and Dr. Moeti was there in person, where we developed a joint continental strategy. And that's the strategy that has been guiding the response for all 55 member states. And the strategy, as I mentioned earlier, was subsequently endorsed by the Bureau of the Head of States, which we continue to report to them almost on weekly basis. And there's a coordinating committee of ministers of health from all 5 regions and the regional economic bodies that come together every week, every Monday, to discuss and coordinate their efforts there. So in as much as countries are implementing all measures that are important to prevent and control the spread of COVID, there's a continental approach to it. And I think we've been very pleased with the manner in which countries have taken on this, and the ministers are coordinating and the head of states are coordinating.
Great, thank you very much. And as we near the end of our time together today, I'd like to ask each of the panelists if you have any final remarks or closing points that you'd like to make to the group. I'll start with Africa CDC, Dr. John.
Yeah, I think, let me perhaps echo what others said. This is a global health crisis that involves the whole world. We are at war with COVID-19. And it's very clear that in my mind and the Africa CDC that the local battles will be won, but the victory must be global, which means we have to stick together and continue to work collectively as fast as possible in a way that we can, that COVID, with understanding that COVID-19 would not be eliminated anywhere if we still have cases on a continent, especially a continent as vast as Africa with about 1.2 billion people.
Thank you, Dr. John. Dr. Moeti, do you have any final remarks?
Yes, I would very much, first of all, like to echo what John has said. And then just add that I believe one of the biggest strengths we have is African people, is their resilience. Because if we look at some of the experiences that people are going through today with these lockdown measures, and some of the results that we found in the study, that people understand and people accept that some of this has to happen, but they would very much appreciate, if you like, mitigation measures being put in place to support them, to support some of the most acute problems they face, to put food on the table on a daily basis. And we know that African people, once they're organized among themselves, can be a powerful force for change and for action. So I would just like to very much endorse this strength in our societies, in our communities, and encourage that we all work with it. We work with their resilience, their wisdom, the years of suffering they've been able to overcome in Africa. This is one of the strengths that we have, and we need to leverage it to the maximum in facing up to this pandemic. Thank you.
Thank you, Dr. Moeti. Tom, any final remarks?
I would thank WHO, Africa CDC, World Economic Forum, and all of our partners, Ipsos, and everybody for this important work. And I guess I would leave with this thought: be careful of false dichotomies, open versus closed, public health versus economics, us versus them. In fact, open and closed are gradations, as Dr. Moeti said, and South Africa has a very good system of thinking of it as a dial rather than an on-off switch. Public health and economics are aligned because the more we control the pandemic, the better our economies can do. And ultimately, we're all in this together. Finding the balance, the essence of this report, is about weighing the things that are going to maximize our chances of saving lives, reducing infections, preserving our economies. And data is critically important for that. Informed decisions can save lives. And so we're delighted to be part of this important collaboration. Thank you.
Thank you, Tom. And Daryl, I will leave it to you for the final remarks.
Well, thank you very much. I'd just like to, I guess, pick up on what Dr. Frieden just said. Data is incredibly important to doing this. Data are facts. There's a lot of opinions out there. There's a lot of different types of statements that you hear from people that are basically based on what they think rather than what they know. So I think it's really important to have this base of data to begin our work, and just to say that we look forward to doing more surveys like this with our wonderful partners that discovered each other through this particular journey, because we didn't really have anything like this before. It's the first time I can remember doing anything like this. So very pleased to be part of this and look forward to more of it.
Thank you again to all of our esteemed panelists. And as we bring today to a close, I want to remind everybody to take the time to access and read the very first report of the PERC partnership, responding to COVID-19 in African countries using data to find balance. This report will be available online at preventepidemics.org, and it will also be sent to everyone who has registered for this press conference. And on behalf of the World Economic Forum and our partners in the PERC partnership, we thank you for your time today.
Thank you.
Thank you.
So that briefing coming to an end. Over 21,000 people surveyed in 28 cities in 20 African countries. The importance of data when it comes to tackling the COVID-19 pandemic brought up, and of course the challenges that come along with that pandemic. The experts saying that it's not just a health challenge, but it's a political and economic challenge. Food insecurity, an issue on the continent. We heard there that humanitarian corridors will be open so that food aid can be given to people who need it. A lot of insecurity from people surveyed, over 70% of them saying that food and water would be issues if they had to stay in lockdown for 14 days. I'm sure we'll bring you a little bit more on that later on. Let's come back to South